Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Today's topic has to do with antidote to dementia, prevention of vascular diseases. When we talk of dementia, it is a conglomeration, more or less, of many diseases. It describes the problem of being not clear in thoughts, memory loss, and all those things that has to do with the cognitive faculty of a person. And part of dementia is the Alzheimer, Parkinson disease. But these are problems that people don't want to really come to if they have a choice. I have people who have said if they have a choice, they prefer other problems to the ones that to dementia. And but when you have it, there is no way you can improve on it because it's more or less like it has no cure. But can we prevent it? It is that area of prevention that I want to concentrate on, and that has to do with the risk factors of vascular diseases, which are many. It has to do with the channels, the blood channel. When you talk of vascular disease, you are talking of the blood channels, where the blood vessels, all those problems that has to do with the things that will cause problem in that area, like hypertension would cause serious problem that may lead to atherosclerosis and other things that would disturb the vessels. It's like a clock in the wheel of progress. When you look at the channel that blood passes through from the heart to the brain and stuff like that, that is what I want to concentrate our effort on today. When the blood does not go to the brain, it could cause stroke or cardiac problem when it is not going to the heart. So the brain could have serious problem because it's not receiving the nutrients and the oxygen that will keep it alive. The same thing with the heart, which we call myocardial infarction. These two conditions are instructive and indicative of what could result in dementia later on. So as we move on to the slide section, if you like my presentation as usual, press the like button, subscribe, and more exposure will come your way. The outline: objective introduction, vascular diseases, risk factors, lab diagnosis, and recommendations are all I shall be talking on in this video. The objective: to create the necessary awareness of the incrimination of the risk factors of vascular diseases as showing a causal relationship with dementia and how the timely laboratory diagnosis could help in its prevention. The introduction: dementia is a general term that represents a group of diseases and illnesses that affect your thinking, memory, reasoning, personality, mood, and behavior. That is, talking about your mental health generally. About 5% to 8% of all people over the age of 65 have some form of dementia, and this number doubles every 5 years above that age. It is estimated that as many as half of people 85 years of age and are older have dementia. According to WHO, in 2021, 57 million people had dementia worldwide, over 60% of whom live in low and middle income countries. Why is it always the problems of these low and middle income countries? Every challenges. Every year, there are nearly 10 million new cases. Alzheimer's disease is the most common form of dementia and may contribute to 60 to 70% of cases. Dementia is currently the seventh leading cause of death and one of the major causes of disability and dependency among older people globally. Vascular disease, on the other hand, is a broad term that encompasses any disease that affects the blood vessels. Peripheral arterial disease, PAD, narrowing of the arteries in the arms and legs due to plaque buildup, restricting blood flow. That causes serious blood pressure. So when you're talking of high blood pressure. Aneurysm, a bulge of weakening in the wall of an artery or vein. Thrombosis, formation of blood clot in a blood vessel. could seriously cause serious health problems. Phlebitis, inflammation of a vein. Heart disease, conditions that affect the heart, blood vessels such as coronary artery disease, hypertension, diabetes, and smoking are widely recognized modifiable risk factors for dementia. So we can hypothesize that vascular health equals brain health. Vascular diseases, risk factors. Vascular diseases can be caused by various factors, including atherosclerosis. The plaque buildup in the arteries, leading to narrowing and reduced blood flow. It can also break that parts of that blockage. The little could go and block the heart, causing coronary heart disease, that is the blood supply to the heart itself, and also the blood supply to the brain, where it could cause stroke. It could also cause problem with pulmonary problem, the blood supplies to the lungs. There are other things like inflammation. Once there is inflammation, as seen in Behçet's disease, the inflammation can damage blood vessels. Infection is also another cause. Infection can cause scarring and narrowing of blood vessels. Some virus has even been indicated in Parkinson's disease as a causative of even that type of dementia. High blood pressure is the chronic high blood pressure can weaken and damage blood vessels. Diabetes, high blood sugar can damage blood vessels and increase the risk of vascular disease, because we are talking about the diseases of that vessel. Smoking damages blood vessels and increase the risk of vascular diseases. Genetic, it could be in the family, and predispose people to certain vascular diseases. Laboratory diagnosis. Alzheimer's disease, AD, account for about 2/3 of all cases globally, cases of dementia. That's a finding reported by somebody. Worldwide, it is estimated that 41 million individuals with dementia remain undiagnosed, with approximately 25% of all dementia cases clinically identified. So we are now saying the clinicians could easily identify, even the psychiatrists, the neurologists, they are experts in this field and could identify. But the average time between onset of symptoms and diagnosis of this disease is approximately 2.8 years. That is the stages that advancing stage, progressing later stage of diseases at the time of diagnosis. So if we are able to diagnose the risk factor that are causer of vascular diseases, the choice of nipping it in the bud becomes more of the client or patient's effort at self-control, lifestyle changes, and other things that could help to prevent the onset of dementia. BP is not the most, it's the most commonly used test. CSF tests are also done to check for certain parameters, blood tests, genetic tests, and even the imaging of the brain, scanning. All this EEG could be done. Laboratory tests are the lipid profile test, the glycolated hemoglobin test, the fasting blood sugar. There are unlimited number of tests that could be done. Yes, finally, the recommendation. My objective is clear: to expose how we can prevent dementia, because the biomarkers test for dementia would only be diagnostic of advancing dementia at the later stage of it. You have some biomarker tests that could even detect the level, the CSF, collecting the CSF to know the tau protein, and some other which I had treated in other videos, that will show, yes, these things are reducing or increasing in or aggregating and advancing dementia. Monitoring the risk factors by correcting the derangement of laboratory parameters that are associated with vascular diseases like peripheral vascular disease, atherosclerosis, diabetes, and even genetic tests will be helpful in avoiding the eventuality of dementia. It might even be helpful to people who are already suffering the disease to de-escalate and prevent worsening the disease situation, though researches are ongoing to see how people in their 80s, if they monitor their BP and other variables that are associated with vascular disease, would help reduce the severity of the dementia. So monitoring your BP is therefore not only the way of prevention. You need to join all these other parameters, variables, and you have a better monitoring to really not worsen the situation. Like I've always said, you can't always click into my video. There are so many videos on this channel. Just press your interest, the health topic you want to discuss, and you'll find it here. So if you like my presentation, press on the like button, subscribe, and more will be shown to you as we look at the references quoted.